Hello and welcome to the first of 4 educational mini-series provided by the Berks County Area Agency on Aging. My name is Ann Barlet and I am the host for the show. Our series is all about Medicare, and today's segment is Medicare versus Medicaid. So I'd like to welcome Dot Hartman back with us. Dot is the Vice President of Community-Based Aging Services with Berks Encore, and we had one segment already on understanding your supplemental coverage. Today I think the other confusing topic that we're going to talk about for folks to better understand is Medicare versus Medicaid. And that just, you go, huh? That in alone just starts the ball rolling. So let's start right in on, tell us, Medicare versus Medicaid, Dot.
Sure, yeah, and that is confusing, and people say, I have Medicare, Medicaid, something like that. Well, it is different. So Medicare is the federal insurance program that's available for anyone age 65 and older, or if someone's been collecting Social Security disability benefits for at least 2 years, they are also put on Medicare. So it is the health insurance that people are required to have if they're 65 or older, unless they're covered by an employer group plan. But if you're not working, then Medicare is the insurance for you. You can't have something through the federal marketplace that's available now. You must be on Medicare if you're 65 or older. So that's Medicare. Medicaid, on the other hand, is available to anyone any age of low income. So Medicaid is for young people. It's for people that are unemployed. It's the health insurance that's available for people that have very low income and can't afford to buy a plan themselves. So people can have Medicare and Medicaid if they're eligible for Medicare. Medicaid can be used to pay the supplemental parts. But you can only have Medicare when you're 65. That's kind of the important thing to notice. And if someone is on Medicaid prior to that and they turn 65, they do have to transition to Medicare.
Okay.
And again, that can be hard for people because it does mean changing plans. It shouldn't mean changing doctors or anything, but it does mean changing how you're getting your benefits.
Okay. And before we go further, you are also available to help folks do that, right?
Correct.
We need a resource out there. So Dot and some other folks at Berks Encore who are trained to be health insurance counselors, you can make an appointment by calling Berks Encore at 610-374-3195. Should you find that you might have been using Medicaid and then, as you said, turning 65 and knowing, oh gosh, I have to make that change to Medicare and I don't really know how to do that and what to do. And what does that mean? And you said about helping to figure out what the benefits are, so you can help educate those individuals.
Right, we certainly can. You know, if someone's on Medicaid, oftentimes they have communications with someone at the county assistance office. But yeah, that's often hard, for them to know what all their choices are with Medicare. So oftentimes they refer people to us, but we'd be glad to help people understand what the benefits are, because things will change. We hope it goes smoothly, and usually, it is seamless for people, but it's definitely a change that they need to be aware of.
And you don't want a gap. You want to make sure you've done it right and correctly, so there isn't a gap and you're going to get something done or completed. And
correct.
Okay.
Yeah.
So I guess my question is, repeat again why I might be on Medicaid. So you said it was for those folks that could be just about any age.
Medicaid, yes.
But might be unemployed, so their income might be
It's income
or very low.
Right, and with the Medicaid expansion that happened for Pennsylvania in 2015, I think for a single person now, the income limit is like $13,000 in that range, $14,000. So it's less restrictive. It used to be quite a bit lower. It used to be that you had to have low income and in poor health. Now it's just low income because they want everyone to have insurance. So yeah, so I don't have the details on the Medicaid under 65, but I do have it for over 65. So if you'll put up the first slide, we're going to talk about some of the different programs that are available.
Okay.
And really there's multiple levels that you can get assistance. So the first one, which these program names, don't mean anything to anybody except if you're working these program names. But so the first way you could get help is to have the Part B premium paid for. So the most that you would make as a single person, this is income, would be $1,324 a month, and that equates to the yearly income of $15,889.
Okay.
Now, they do also look at what they have as resources, and that would mean money in your bank account, any CDs, any stocks. If you have like an IRA, it would count as one or the other. So if you're drawing income out of the IRA, that would count as an income number. If you have that IRA sitting out there and you're not drawing on it yet, then that would be a resource.
But they look at both.
They look at it, yes.
Okay.
They look at what you have, both income and resources.
Okay.
So if someone would qualify under that income and resource limit, there is potentially help to have your Medicare Part B premium paid for. So this is the highest income that you can have. And there's a little note there that says Congress votes each year on whether to offer this for people with this income limit. So they're stretching the income limit a little bit, but it's not guaranteed that monies will be available to help those persons. If you drop down to the next level, if you are at $1,177 a month as a single person or $14,124 a year, then you will get help paying for the Part B premium. This year it was $104.90. So the government is going to, the state actually pays that for you. Again, they look at your resources, so you have to be under that limit of $7,280 in your bank accounts, savings, whatever. But if you do qualify for that, then you can have your Part B premium paid for. So that, that $104.90 can be, a big chunk for someone to pay, especially if they've been maybe on medical assistance up to now, but there is help for that from the state. And those applications will all be processed through the county assistance office. We can help with those.
Okay.
Again, if someone's been on Medicaid, most likely they're going to have that done for them. But if they're not sure, they should definitely call. And they'll notice when they get their Social Security check that first month that Part B starts, if it's short. So if they're taking the Part B premium out, now your Social Security check is going to have $105 less deposited.
I was going to say, isn't Social Security direct deposit?
Right.
So
it's
you
watching
really
what
have
goes
to
into your bank account.
that you're having a little bit less. So let me backtrack again, just because I know we only got to the two of these programs, but let's stop there for a second and just make sure that if I identify that I'm an individual, oh yes, I'm into this particular guideline income-wise, and I contact you, you would have applications or be able to get them, help me complete them, but really, then you pass them along to it's the local Berks County Assistance Office, correct?
Correct.
Who then will review all this. What might I need to bring with me to show you? I can't just say, oh yeah, I make this. I make less than that. What would I need to bring along?
Sure. Usually your bank statement has two pieces of information on it. We'll probably have your Social Security deposit or any income that you're getting if it's deposited right into your bank account. If it's not, then any kind of statement of income. So if you're getting a pension check or something from other sources, then any income statements would be good. If you have what Social Security sent you at the beginning of the year saying this is what you're going to be earning.
So that would be good. I wouldn't have to bring several months worth to show you that on a consistent basis this is what's being deposited.
It's always the same amount. So income, any statements from the employer or Social Security that's showing you the income. Your bank statement is needed to know how much you have in any banking or savings, so any accounts that you would have from that regard, as recent as you can be. And of course any IRAs, anything that would show where you have assets. Yeah, so that's all.
And would I need to bring a proof of age?
We do, yes, they do ask for a copy of your driver's license or Pennsylvania ID, so that would have all of that on that. And then if you have Medicare, we would want a copy of that, and we would copy as much as you bring in and send it along with your application. If you don't have all the proof documents, then we send what we have, and then they would contact you for any more needed documentation.
Okay. And then also my question is, because we're talking about, as you're turning 65 and you've got the Medicare and then you're taking the Medicaid, time frame to do all of this, I guess is my question.
You can't apply to have your Part B premium paid for until you're on Part B. So it is a little tricky.
Okay.
You can do it the month before, but not more than that.
Okay, so the month before the birth month that you would be turning 65.
Yeah, or if you're going onto Medicare because of Social Security disability rights.
Okay.
But yeah, you can't do it before 30 days ahead of time, or they'll just say, yeah, come back.
So the pre-plan,
Right.
be patient.
You can't be too much ahead of time.
Gather the information
For sure,
that you
yeah.
will need to help fill out. So then, I guess the next question is: so if I do that, how long does it take?
Yeah. So they say it'll be 30 days from the date you submit it. So if you submit it in early November, they would let you know hopefully by early December, and they will backdate from when you submitted it. So if you were approved in November, then maybe in December they would be removing the 104.90 because it didn't get through the system yet, but you would get that back.
Okay.
So they will pay you back any Part B premiums that were taken out after your application was received, if you are approved. So yeah, sometimes you have to wait for something to be paid back to you, or the premium to be paid back, depending on the timing.
Okay. All right, good. All right, I think I've got those. So do you want to move?
Yeah, let's go down. Let's pull
further?
that chart up again,
Okay.
and we'll talk about the last two categories. Very, very similar to each other. So this is the Quimby is where it says for full Medicaid. So what that means is you get the Part B premium paid for, as well as any co-insurances and deductibles along with original Medicare and Medicaid. So basically, Medicare is going to pay for what they pay for, which is 80% of costs, along with some deductibles, and then Medicaid will pay for everything else. So you will not have to do the 20% co-insurance. You will not have the deductibles. The Medicaid benefit will pick up what you're left in, after Medicare pays. So it is a lower income level. That is $981 a month, or $11,770 a year for a single person. The same resource limits apply there, so you can have the $7,280 in resources to get that Medicaid benefit. And you will get that in form of an access card.
Oh, okay.
So you would have your Medicare card, and then you would have an access card to pay what Medicare doesn't. So that's what you would want to show at your doctor and hospital visits. You do need to get a drug plan, though. Okay. So access does not pay for medications when someone's on Medicare. It does when someone's earlier, younger than 65, but once you're on Medicare, and because there are drug plans out there, they want you to get a drug plan. You won't have to pay for the premium, though, and your co-pays will be significantly reduced. So you'll have co-pays of like $1 something and $3 something for brand names, $1 for generics, but you'll actually have a prescription plan that you're on, and knowing that you have that Medicaid benefit will reduce the costs that you have. And like I said, you shouldn't have to have a premium for that prescription plan. So that would basically be considered having Medicare and Medicaid, and you use Medicare and Access.
And therefore, let's clarify again, for me, if I have Medicare and Medicaid, the main card that I'm showing, people to know, I'm showing the red, white, and blue, traditional red, white, and blue Medicare card,
Right.
or the Access card, which is a different type of card, color card.
You're going to show both.
Okay, so
Medicare is the primary.
Yes.
So now that you're 65, the state doesn't want to pay for all of your health insurance. Okay, so they're going to let the federal government do the Medicare benefits, but the state will pick up what the federal government doesn't.
Okay.
So you won't have any out of pocket, but your Medicare will be primary and Access will be secondary.
Okay.
Okay.
Got it.
And then there's one more. If your assets or resources are actually lower than that, down in the 2,000 level, same income but lower resources, you get a few extras.
Okay.
It does give you some extra vision, dental, and the prescription coverage would be some over-the-counter stuff that you would get again through the Access card. So those would all be just some additional benefits that fall into there when you have the resources.
Okay.
So we're talking about Medicare and Access. There is another option, and that would be to get a Medicare Advantage plan that would act, instead of having Medicare and Access, you would use this plan instead.
Okay.
So I have some information, if we can pull the slides up on that. So these are called special needs plans. And they're for people with Medicare and Access. There also are some for chronic disease, and there's some for people in nursing homes. But today we're just going to focus on the ones for people with Medicare and Medicaid.
Okay.
You do have to have it to qualify, so just not anyone can sign up for these plans.
Okay.
They would check.
It's not part of those general plans that we talked about in another segment.
Correct.
Okay.
Correct. You have to prove that you are eligible for Medicaid to get these plans. So in Berks County, we have 4 different companies that, again, are giving us Medicare-like benefits, but in their plan design. It's Gateway, Geisinger, United Healthcare, and Advantra are the 4 different plans that you could choose from. And which plan you choose will probably depend on where you go to the hospital, because not all of the plans are at both hospitals.
These are not all accepted by the 2 hospitals in Berks
so,
County.
So Gateway and Advantra, you could go to either of the hospitals, St. Joe's or Reading, but Geisinger and United Healthcare, Geisinger is only at Reading. Oh, they're both only at Reading. Yeah, so it depends on where you go and what your doctor accepts. And that's the reason that somebody would choose to stay with Medicare and Access would depend on what their doctor takes.
Okay.
So if their doctor, and I'm not talking about hospitals, but their doctors, that they see primary and specialists do not take these plans, then obviously they don't want that. Okay, because then the co-pays would not apply to them. So you really want to ask your doctor, what do you take? Some of them are more, they want to take Medicare instead, and they will use the Access card to pick up the differences. Others will use these plans.
Okay.
And when you have the plans, I mean, the benefits are similar to having Medicare and Access. You really have no co-pays. You have no monthly premiums. You have no co-pays. So that's obviously nice. The things that these plans give in addition are some of the dental, the hearing aids, the vision. So these are the reasons why people would choose to have one of these special needs plans, that they get some additional benefits, some transportation. They have companies that they can call to get transportation to and from doctor's appointments.
Oh, okay.
They might have a fitness benefit. They have money towards over-the-counter items. The hearing aid, money towards hearing aids, money towards dental and dentures. So that's why somebody might want to have a special needs plan instead of just having Medicare and Access. But again, it depends on where you want to go.
Okay.
If you go out of the area, again, the special needs plans would be Berks County and maybe Lehigh, but yeah, pretty much in this area. So we can help work through that. But it's always good to ask your doctors what they take and what they'll honor, because if you shouldn't have to pay out of pocket for anything. So you want to make sure you have the plan that your providers take and allows you to do that. And there really isn't a lot of difference between those plan choices. This is where there would be the dollar benefits might vary a little bit on what they're giving towards hearing aids or dental.
Okay.
But when they look at the list of plans, which one should I take, there's not a huge difference. They're pretty much very similar benefits.
I was going to say, so if I'm choosing these, you just said the 2 primaries, of course, the hospital and the physicians.
What they
know
take,
what it is that they take, so check with that first.
Right.
And again, we're all so used to cards. Is there something different that I show as a card that I have? Okay.
Right. If you joined one of the special needs plans, that's the card you would show.
Okay.
You would not show your Medicare card. You really wouldn't show anything on your Access card unless Access cards have food stamps benefits on them as well. So you might use your Access card for that, but you probably would not use it for any medical reason.
Okay, because I'd have my special needs plan card that I would show.
Right. You
when
would have
needed.
Okay.
Yeah. All righty.
The other thing I'll just say, because people often ask this, again, if they're coming from under 65, being on Medicaid, and going to Medicare and Medicaid, Gateway is the only company that does both. I guess United Healthcare might have some plans for under 65, but it is a total change of plans. So even if they were with Gateway before and they want to stay with Gateway, it's getting into a different plan. And some of the companies that they might have under 65 are not available as Medicare plans, so they do have to make a switch.
Okay. And is there a disenrollment procedure? I mean, we've only been talking about enrollment.
Right, yeah.
So if I find myself in that boat where I'm now turning the age, I've got to move forward, I'm going to take one of these, do I disenroll, or do they realize that?
Yeah, they usually know if you're moving from a non-Medicare plan to a Medicare plan. yeah, the plan that you're with as under 65, they know that you're turning 65. So, yeah, I don't think there's really any notice you have to give. If you're in a Medicare special needs plan, you can actually change any month. Anyone that gets financial assistance through the government programs can change plans any month they want to. And the way you disenroll is by enrolling in a new one.
Okay.
Or if you're in a special needs plan and you want to go back to having Medicare and Access, you would just pick a drug plan, a standalone drug plan, and then that would notify them that you're getting out of the Advantage plan option. So, but you can, if you find one that isn't working for you, or you found a doctor that didn't take it, or you can always change.
That's the thing. Your doctor retires, know, and you're not sure if that same, maybe they weren't in a group. They might be in a group, and so the group might still take it, but.
Right, if you change physicians. So they've tried to make it as easy as possible for persons in this, where they really just don't have the money to do something unexpected. So you are able to change, but it's always, it always changes the start of the month. So it's not a mid-month thing, but at the start of the next month, you could always change the way you're getting
I guess
your
and
coverage.
be mindful then of if there's something that you're going to be having done, a lab being done, or another kind of preventive screening to make sure the switch has been made.
Right.
So it is covered.
Right, exactly.
Okay. And then again, they can contact any of the folks at Berks Encore who are doing the Apprise Health Insurance Counseling Program to sit down and again review these special needs plans, make sure they're qualified. You'll help. Is there another, again, an application and whatnot for that? How does that work?
With these special needs plans, they do require a paper application just because they want to make sure someone is eligible with having the Medicaid benefits. So it is a paper application. We get like one application a year from the plans, but typically once you decide which plan you're thinking of, we'll direct them to call that plan's 800 number and get the application set up if we don't have one available. But that will be a paper process because of again, they have to make sure that they are eligible for Medicaid rather than just doing it online. If you're going to use Medicare Access in a drug plan, then we can do the drug plan enrollment online. There's nothing required there, but to get into one of the special needs plans, it is a paper application.
Okay. All right. My goodness. And we didn't even talk about some of the other options that you said as far as being younger for the Medicaid situation or the situation with somebody using Medicaid in a nursing facility. So that's a whole other potential topic there.
Yeah.
Okay. Because I know that there are folks that don't still quite understand that as well, and particularly when folks have gone there from a hospitalization to a nursing home for rehab, days covered through Medicare, and then sometimes they don't recoup enough to be able to leave the nursing home, and now they're in there, and who pays for what, and that's a whole other topic that I think we could get into sometime. If in the last minute or two, if you wanted to wrap up this particular segment, again, Medicare versus Medicaid, what would you like to share, Dot?
Just making sure people are aware of what they qualify for, and sometimes people are spending down resources, and now all of a sudden they're under that limit of $7,200, and they don't realize that they could be having their Part B premium paid for, or even more benefits. So just awareness for people that there is help out there, because when you're on a limited income, that $104.90 every month for Part B is a big deal.
Yes.
So I would say that's where people aren't maybe aware of being eligible for that benefit. But if you have any questions, just give us a call. We're glad to go over that with you and to help you with any part of the process.
Good, thank you. Well, again, I wanted to thank Dot Hartman, who's the Vice President of Community-Based Aging Services with Berks Encore. Remember, again, you can give them a call to help you sort it all out and all the facts about Medicare, and their number is 610-374-3195. And thank you for tuning in to this segment about Medicare versus Medicaid in our series all about Medicare.